I have one eye bigger than the other. What can I do? Since I was a child, I've had uneven eyes. My left eye is smaller than the other, and it shows so much in pictures. I went to 3 doctors before in my teens, and they all told me that my vision is good and that nothing is wrong with my eyes, except that they are asymmetrical, and that the only way I can fix it is by surgery. I'm 20 years old, and it really bothers me, and I wish they were the same size.
Thank you for your question. You're 20 years old, you've submitted a single photo, a close-up of your eyes, and you state that you went to several doctors before your teens regarding the unevenness between your two eyes. And it was explained to you during these doctor's visits that your vision was normal and that you didn't need surgery. And now at the age of 20, you're asking about having your eyelids look more even. Well, I can certainly give you my opinion based on the limitations of the photos you submitted. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As a cosmetic oculofacial plastic surgeon, I do a lot of procedures to help people have more even-looking eyes. So I'll be able to give you some guidance as to the terminology related to your situation and the basis for delaying any procedures and what your options are at this point. So to begin with, when I look at your photos, I note that the right upper eyelid is lower than the left upper eyelid. Now, the term for an eyelid that's low is, we use the term called ptosis. Ptosis means drooping, and when we refer to eyelids, we call it eyelid ptosis. Now, specifically, in a situation where someone is born with it, which appears to be the case for you, it's referred to as congenital ptosis. Congenital ptosis means that the muscle, called the levator muscle, the levator palpebrae superioris muscle, is a muscle that didn't fully develop, and therefore it doesn't contract like a normal muscle, nor does it relax like a normal muscle. So when we perform a ptosis evaluation, we look at the level and degree of ptosis, and we also look at the muscle function. And that's a proper evaluation. Now, before the age of 6, ptosis has to be monitored in a way to ensure that the vision develops appropriately. Basically, if the ptosis is blocking vision or in any way minimizing or disproportionately reducing vision in one eye, then that eye can have permanent loss. We refer to that as amblyopia. What your doctors were able to establish through proper ophthalmologic examination was that your vision wasn't affected. And since your vision wasn't affected, they advised to defer surgery, and I think that's very reasonable. With this type of surgery, if you can wait till your face has grown and the face has developed more, then that's ideal. If, however, there's a vision issue and visual development is in question, then you do the procedure to lift the eye. So, at the age of 20, you now have the opportunity to now have a ptosis operation. So what is involved in a ptosis operation? Well, at this stage of your life, you can undergo this procedure. What we would do in our practice with someone like yourself is, first we have to decide what kind of ptosis operation is necessary, again, with the proper examination. But essentially, there's 2 types of surgeries. One is where the muscle is shortened to get the eyelid to open, and one where the muscle is bypassed, which is referred to as a frontalis sling. Now, after the evaluation, we figure out what operation would be ideal. But what's particularly good about dealing with someone who's a little bit older is that you can get their cooperation. Ptosis surgery is deceptively complex. It's actually a very delicate operation that requires optimizing the shape, the height, the contour, and the symmetry. So what we do routinely in our practice when we're doing this type of surgery is we'll actually sit someone up and look at them from with their sitting up, and then the staff and I look together and we look at the eyes to make sure they look good, look balanced, and it looks right. And that type of finesse maximizes the success for outcomes. However, there's always a percentage of patients who might get an overcorrection where the eyelid is too open or an undercorrection where the eyelid is too low. So you have to basically get proper examination and evaluation, and you have to understand what is the best procedure at this stage. Understanding that the muscle is not a normally functioning muscle is something to accept, so that you go in with an understanding that your eyelid can look symmetric, but usually mostly in the primary gaze when you're looking at somebody. And sometimes it might be with poor levator muscle function when you raise your eyebrows or you engage the muscles needed to keep that eye open. But again, this is getting, without an examination, there's details that really can't be determined and to further make more recommendations. So again, in summary, you have congenital ptosis, have an evaluation, and see from typically an oculoplastic surgeon, an oculofacial plastic surgeon, someone who did eye surgery and then specialized in plastic surgery of the eyelids and face, and learn about your options. So I hope that was helpful. I wish you the best of luck, and thank you for your question.